What's interesting is the first thing they did is they held a press conference and said hormone replacement therapy is going to cause heart disease, breast cancer, and strokes and blood clots. You alluded to the fact that I was sick when I was a kid. When I was 16 years old, I was in Africa and had malaria and typhoid fever and was very ill. I dropped down to about 110 pounds, which 5'11", 110 pounds doesn't sound good.
Yeah.
It took me a long time to recover.
Do you see that impacting? I mean, people that come in and they're demanding certain pharmaceuticals because they've seen it on TikTok or somewhere like that, and then having to tell them more about the lifestyle piece. I mean, is that something you deal with on day to day or see quite often?
So is it that people listen to the loudest without looking at credentials or thinking through this with critical thinking skills? If I'm making a ton of money on my supplements that I'm giving you, should you ask me more than just automatically listening to me?
Dr. Patricia McClellan, thanks for joining us today.
Thank you.
I'll be honest, this is the most nervous I've been about a podcast. And whenever we were talking and then Matt followed up again, it's like, hey, I think it'd be, you should have my wife on the podcast and talk about women's health. And I'll be honest, I'm like, what the hell do I know about women's health? Where did I even start? But obviously you know about women's health, but I was trying to learn about the questions and things to ask. I even asked like ChatGPT, but it gave me all these like very just, none of them really hit home. But then I read your bio on the website and it was really well done because it gave me a bunch of information about you, got to know you, and there are a few things that stood out. And like talked about earlier, we're talking about how you got sick apparently as a kid, so I'm curious to hear about that. And then kind of your, what's the word for it? How you like to treat, I guess, and some of the ways the holistic approach. So those things really got me interested. I'm like, all right, I think I can do this. I've been talking before this, I got even more interested. So I don't know, where do you want to start?
Well, we can start out what started me on this path. You alluded to the fact that I was sick when I was a kid. When I was 16 years old, I was in Africa and had malaria and typhoid fever and was very ill. I dropped down to about 110 pounds, which 5'11", 110 pounds doesn't sound good.
Yeah.
It took me a long time to recover. And before that, my focus was playing basketball. I had this dream of playing on the Atlanta Hawks.
Yeah.
With Dominique Wilkins and Spud Webb. I would be the first woman.
Yeah.
Obviously, that was a little bit of a pipe dream, but basketball was my focus. But after that, I realized a couple things. Number one, the absolute importance of health. The other thing that I learned was I was basically alone, and I didn't really have support. There was this lovely priest and his wife who came to visit me every day. But other than that, there was very minimal support. So it really gave me the passion on helping people, and I understood what it felt like to be really sick and essentially being alone. So those were two very big things. And my desire and my passion for what I wanted to do really became laser focused. And so that's when I decided I wanted to go into medicine. And I also realized, for good or for bad, I was on my own. If I wanted to accomplish this, it was Tricia accomplishing this. And there's definitely pros and cons to that, but that became my laser focus.
So malaria and what was other?
Typhoid fever.
What was that like? I mean, how long did that last?
I was in the hospital twice, and one of the times I had a really high fever for several days, and now I knew what it meant to hallucinate. Wow. When you see things that aren't there and stuff like that. It was not a good experience.
Yeah, I bet not. How did you get to Africa? Just a trip there?
Well, I went with my dad. He did a missions trip, and he took students to go, and I went on one of them.
Gotcha. So did you get all your get better in Africa, or did you fly back and then get better in the States?
No, I got better there,
Okay.
but it took me quite a while to build up my strength. At least I was still playing basketball, but it probably took me 6 months to a year
No way. Wow.
to get back to how I felt before.
So
Now, I was never that great. Okay.
basketball, or
I wasn't as good as I wish I was. So it implies that I was like some high-level athlete.
yeah.
But I never quite got back to where I was before with the strength and stamina.
Wow. I mean, that kills a lot of people, though, right? I mean, malaria.
Oh, it can.
Yeah.
It can.
So then you came back, and I saw you did a stint. You went to Oregon for a while.
Correct. So I went to Vanderbilt for undergrad and medical school, and then I went to Emory for residency, and then I went to Portland, Oregon. And there were several amazing parts about my time in Portland. One of them is I joined a group that had a true mentorship program, which was amazing. And you don't really see that, at least at that time, you just didn't see that level of mentorship. And so that was amazing. The other really wonderful part about being in Portland during that period of time was healthy lifestyles were very important and were just part of people's lives. And so people were committed to eating local. People were committed to eating organic. People were committed to moving. And it was just part of life.
Yeah.
And I saw, after moving from the South out to Portland, the incredible impact on women's health issues when you address lifestyle. The other thing that was great about that is there was a well-known naturopath who was in Portland who kind of set the stage of quality for naturopaths who also worked collaboratively with physicians. And so you had a very good relationship. I only met her once or twice, but her impact was pretty amazing. And so that also was very helpful, because one of the things that frustrated me was when I'm looking at women's health and all I have is medications, I could see I'm not helping people the way I want to help them.
Right.
Not as many people are getting better or feeling better or thriving as I would like to see. And I listened to a podcast where there was a physician who said years ago, 90% of health issues we dealt with were things outside of our control. Like you got run over by a bus, you got cancer or something like that.
Yeah.
Now, and I'm not sure I totally agree with this, but he said 80 to 90% of the health issues we deal with are based in lifestyle.
Wow.
So I would say maybe 80%. But bottom line is, especially in women's health, there is a huge component of lifestyle. And what that means is if I'm going to help you and really help you, I need to attend to that.
Yeah. Isn't it interesting? I don't know if you experienced this, but talking about going to Oregon and Portland and having that person there you're referencing and more active lifestyle, it sounds like. And I remember back when I was racing bicycles as a kid and up in my 20s, I looked at moving. I almost moved to Bend, Oregon, and then Durango, Colorado. Those are two at the top of my list just because they're beautiful places.
Oh, they're gorgeous.
Mountain biking is amazing. Skiing, everything's great. But how much more outdoorsy everyone is there, and you tend to find more of that holistic approach to healing in all kinds of ways, and I think health overall is higher. I love Chattanooga. Now, we have great outdoors here too, but there is like a different lifestyle here that seems to higher obesity rate, higher everything, drinking.
Well, it's a totally different lifestyle, a totally different lifestyle. And what's even funny is I remember I haven't been back to Portland proper for a while. I go back and I visit friends around Portland, but I don't go to the grocery stores and stuff. So, but I remember even in the big grocery store like Fred Meyer, which would be kind of like Walmart here, you have all the vegetables and you have a lot of local vegetables. You have a lot of organic. And I don't remember things being wrapped in plastic. And then when I move here, I have this idea of I'd like to not have my produce wrapped in plastic.
Yeah.
And that's really challenging to just not get your produce wrapped in plastic, especially after COVID.
Yeah.
That's gotten a lot worse. But because the demand was there, then these grocery stores would have a lot of local produce. The demand was there.
Yeah.
So it was really fascinating what I took for granted. And then coming back, I took for granted that when people said they wanted to look at a lifestyle approach, their definitions were different.
Yeah. I bet so.
It's a different definition. So when somebody asks me, I'd like to have a holistic approach or a lifestyle approach, and I'm making a generalization, but that what's more common is what they mean is they don't want prescription meds, but they want supplements. My view of a holistic approach, I kind of have a six-prong view of that in looking at diet, exercise, sleep, stress management, appropriate use of supplements, and then medical interventions, whatever that may be, if it's medicines, if it's surgery, something. So I kind of look at it in those 6 areas, and everybody is going to thrive more if they look at more than one area. So if I'm not going to put you on 20 prescription meds, I'm also probably not going to put you on 20 supplements.
Right.
I mean, it sounds reasonable.
Yeah. Yeah.
When you look at medicines are studied more than supplements are. And if you look at a study, it's extremely rare for somebody to study their medicine plus 6 others.
Right. Yeah.
Much less 10 others. So you're on 10 meds. What is this going to do? Well, I don't know.
So true.
Now, I know what different individual meds are supposed to do, but all of them together? Yeah, I don't know.
Yeah.
And the beautiful part about a lifestyle approach is our bodies really are amazing, and they are incredibly resilient, and they're so complex. And that's one of the wonderful things about being a doctor that you should be jealous of is I get to look inside somebody's abdomen. I mean, it is so cool, so amazing, so complex. I've been doing this for 28 years, almost 28 years. And every time I feel awe when I'm in the OR of look at this amazing, complex, resilient body. And we will never fully understand all the different functions and how they are in harmony. But we do know that food is what feeds our body. How do we eat healthier? Movement is valuable. Sleep is when we restore.
Yeah.
We know that. We just don't know what our body needs at a specific point for that. And so I love the idea of coming at it from a supportive approach than always an interventive approach. Like, for example, you want me to give you an example?
Yeah.
Okay. So you probably aren't ever going to be perimenopausal in the way I'm speaking about this. But if you were in your 40s and you were female and you're perimenopausal and your hormones are fluctuating, every month can be different. So if I decide I want to give you like a hormone 1 month, what you would need the next month is likely to be different. So we're never getting you at a good harmony that may not last it may last, but maybe not last that long. But if I know that if I'm supportive with a judicious number of supplements, we look at your diet, what is the best way for your body to heal during this phase, and we do it that way, oftentimes I will see much better results. The problem is that it takes more work to do it that way. Does that make sense?
Yeah, it does. So I have a question that's kind of related to this, but it's a little bit of offshoot. But it just popped in my head. My mom and dad were quite a bit older when they had me. So she was 39 and he was 46. And of course, it didn't really affect him. It didn't affect him at all. But my mom almost died, sick as hell all throughout the pregnancy, really bad pregnancy. And she had a bunch of miscarriages all the way to, I guess I was the most stubborn one that finally took. And when she had me, she wound up there's some postnatal toxicity, something. I don't know. That's not it. Something like that. She wound up in ICU and they said she'd be dead next morning. Somehow survived. Thank God, because she's a great mom. Better than I deserve. But questioned me at 39, and luckily she was always pretty in shape, not like athletic, but do you see like someone that stays in shape, stays fit? Like, does menopause, does that wait longer? Can they have kids later? Are they at less risk for, having?
That's a very good question. We call advanced maternal age 35, and it's slightly arbitrary. But as you get older, your risks get higher, are higher for diabetes, high blood pressure, and that's based on what you just said, that might have been her issue. But there's an age-related element of risk that even being healthy does not eliminate. Okay. Now, so that's with pregnancy. With menopause, typically the healthier you are, looking at diet, exercise, sleep, stress management, a lot of women will go through menopause more smoothly, but it's not 100%. So I would put myself in a category of pretty healthy. And I went from feeling fine over a course of 2 weeks. I was having hot flashes every 30 minutes, waking up 3 or 4 times a night with night sweats, which leads to poor sleep. And very quickly, that was not tolerable.
Yeah.
And so there's an element that lifestyle plays a huge role, but that's why I look at those 6 categories: diet, exercise, sleep, stress management, supplements, and medications. And in this situation, I'm talking about hormone replacement therapy. I went from feeling normal to awful and then feeling normal again. But I wasn't going to be exercising when I felt that bad. I wasn't eating healthy when I feel that bad.
Right.
So that's why I like to look at the whole picture instead of just one. Now, the flip side is I have plenty of patients that if they are looking at the lifestyle approach and they're having a lot of symptoms and they eat the standard American diet, the moment they reduce alcohol and carbs and increase protein and vegetables, they can reduce their symptoms by 60-70%.
How many actually do that, though?
10%.
So that 6, the 6 you're talking about, how many do you think you see that rely on the last one on medication versus the other 5 that might?
But see, it's part of your journey, and I look at it as getting into a stream. If you're dipping your toe into the stream by me giving you hormone replacement therapy, then that's where we'll start. And then we get you feeling better. Now let's address the diet, the exercise, sleep, stress management. Unfortunately, people aren't always interested in doing that part or making the consistent changes. So I would say 10 to 20% are going to really dig in. Maybe it's higher in certain areas, but it's not as high as we would like.
Do you see it higher in other countries, like other studies you've seen? Like, is America worse there, or?
Well, I think, like when we've been in Europe a couple times in the last couple of years. We did Mont Blanc, and you're eating. Just the food is better. Okay, so you eat a piece of bread in Italy. There's probably 4 ingredients in your bread, whereas here I have a medical background. I majored in math and chemistry, and I look at the ingredient list, and I don't know 90% of what's in there. Yeah. And if I don't know, then our body goes, I don't know what to do with that. Right. So I think that food and people move more, and food and movement is so incredibly vital for just overall health.
Yeah. Do you think that and this is one theory, I don't know, it's not a theory, but kind of like with now go with me here for a second, with like a car, sometimes cars run better when you get them hot, especially like a diesel truck. And when you get the engine hot, everything's running hot, and it's on the highway for a long time, it runs better. And it will even consume kind of bad diesel fuel better if it's hot. It will just combust it. But if it's cold, then it doesn't like to run as much. I've often wondered if that theory kind of applies to humans in some way, if like that cardiovascular health, having the engine almost hotter. Do you think it helps? I mean, of course, more than just cardiovascular, but even on like digesting bad food, like moving things through your system quicker and getting it out. I don't know. That's
so I think I like that because our bodies are far more resilient than a car. So if you decide not to put gas in your car, or you decide to put water in your car, and it's not going to work.
Yeah,
it's not going to work right away. And everything's going to seize up. Yeah. But it's always amazing to me that, these things are cumulative. So by the time a woman's engine starts sputtering in their 40s because the hormonal changes are occurring, it's not just what's happened that day or yesterday or the day before. It's accumulation of what you've been eating, your exercise, your gut health, all of that together. And unfortunately, it doesn't happen in a day, which means I can't fix it in a day. So it would be, it's probably good that if we feed our bodies poorly, that we don't just end up in the hospital the next day. Mm-hmm. But, if we saw that response as quickly in our own bodies, would we be more thoughtful on a daily basis on how we feed our bodies?
Yeah.
So we're more resilient in good ways, but not necessarily that can backfire.
Right. Gotcha. So on the, one thing we were talking about earlier, the pharmaceutical side, I've dove in the rabbit hole on this one, and some things it's always hard to tell between propaganda and what's real and all that. But it is interesting to me. My marketing advertising background, we're one of 2 countries in the entire world that can advertise direct-to-consumer pharmaceuticals. And
right.
Do you see that impacting? I mean, people that come in and they're demanding certain pharmaceuticals because they've seen it on TikTok or somewhere like that, and then having to tell them more about the lifestyle piece. I mean, is that something you deal with on day-to-day or see quite often, or?
Yes, I do. And it's interesting because you see both sides of the coin. So you see advertisement and you're like, oh, I never want to take that medication because they gave me, 10 risks with that medicine.
Right.
And then the next person is like, oh, I want that. And, a big one right now are the GLPs. Mm-hmm. Semaglutide, tirzepatide, so that's Ozempic, and so all the weight loss medications.
What are your thoughts on those?
What are my thoughts?
Yeah.
I think in context of a healthy lifestyle, it can be very helpful. So here's what's fascinating about those meds is they're doing a lot more than just helping somebody lose weight, but we're seeing a reduction of inflammation. Mm-hmm. So people who have arthritis are going to feel better if they lose weight, but it also seems to reduce that. There's impact on liver. So I think it's really fascinating all the things that it can impact. The downside is that people are looking at this as lifelong medications. Mm-hmm. The expectation is people are not going to maintain the healthy lifestyle to be able to get off those medications.
Gotcha. I heard are there complications coming off them anyways? Is it?
Well, so here's an interesting thing. If we want to just look at the weight loss, okay? So if you are on semaglutide or tirzepatide, in some people you can lose 1 pound of muscle to 3 pounds of fat that you lose.
Okay.
That is a substantial impact on your metabolism. So, for example, you want to lose 20 pounds. You lose 20 pounds with Ozempic, there's a chance you've lost 5 pounds of muscle and 15 pounds of fat. So, at that lower weight, your metabolism is slower, so you are more likely to gain weight more quickly. Now, and I see that. I definitely see that when somebody goes off these medications, they regain very quickly, faster than what you would expect. The problem is if you gain 20 pounds quickly, you're not gaining 5 pounds of muscle and 15 pounds of fat. You are gaining 20 pounds of fat.
Oh, wow.
And so you're going back up to your baseline weight with a lower metabolism, and there's a very good chance that a lot of that fat is more visceral fat, which is what's inside your abdominal cavity, associated with more inflammation, higher heart disease risks.
Wow.
So what's fascinating to me is I tell people this. So I'm fine giving it in context of lifestyle. But on average, at least in my experience, when I tell people to maintain muscle mass and I give them a number for protein, look at your diet, do a food diary at least for a couple days, see what you're getting protein. You need X amount to maintain, you need X amount to build muscle. And in women, it's been shown that HIIT and high weight, low rep strength training is more effective, especially in our age group. Probably about 10% of people will include that. Most people, when they lose weight with medications, they're not really changing their diet. They're just eating less of what they've been eating. And what we don't know is, what we do know is that they are nutrient deficient. So the macro and the micronutrients, they're deficient. And then how does that play a role in the weight gain? I don't know.
So if they lose 20 pounds and 5 pounds is muscle and 15 is fat, is there a way to keep from losing that 5 pounds? Like if they are high protein, they're doing
high protein, the HIIT, the strength training in that manner, that's been, there's not a lot of studies in women on exercise, muscle mass, and we need more of these studies. But what we do have, it does seem, we do have some pretty good guidelines on protein intake. And I'm going to give a shout out to my kid. My husband and my kid helped me with a menopause talk. I created all the slides, and then my 19-year-old boy made them presentable.
Nice.
And the best thing was he added a meme on every slide that was hilarious. But he disagreed with my protein recommendations. He looked it up, and he was right.
1 gram of protein per body weight?
So to maintain, it would be 1 gram per kilogram body weight per day. To build, it's 1 gram per pound per day. Okay. And another thing that he said I was wrong on, and I was, that you could only absorb 25 to 35 grams of protein at a sitting, where what it is you probably absorb most of the protein you're taking in, but only about 25 to 35 grams is actually being used to build muscle.
Okay.
So if I told you to eat 140 grams of protein a day and you did it all for breakfast, you're not accomplishing what you want to accomplish.
Gotcha. So you guys spread it out.
Yeah, you guys spread it out. So he kept me in line. It was great. It was great.
Nice. So with these, semaglutide, for example, like, if they keep taking it, do they just keep burning more fat, or they finally at a certain dosage they hit like the max amount they're going to burn? Like, how does that work? Do you come off of it for a while to keep from just eating everything?
That's a great question, because it has multiple effects. What I typically see is that women will plateau on their weight loss. And so you start them on a subtherapeutic dose, meaning you start them on a dose that's not going to work, but to minimize side effects, because there's a lot of side effects. The main ones are GI, nausea, vomiting, constipation, diarrhea. The constipation can be horrific for people. Wow. But there's a lot of side effects. And so you start off slowly and you build, but you don't change the dose, or you change the dose every 4 weeks, and it's a once-a-week shot.
Okay.
So it could take somebody 2 to 3 months to get to the point where they're losing weight. But most women, in my experience, will continue to have to go up on their dose to maintain their weight loss. And now it's, if somebody needs to lose 100 pounds, that makes total sense. But I even see it in people who are losing, 20 pounds, that one dose doesn't do it and we have to increase it. I have guesses why, but I don't know for sure.
Yeah. Yeah, I didn't know it was eating so much muscle. And I just remember I was listening to a podcast and they're talking about a UFC fighter that was always a bigger fighter, and he got on one of those and how much more ripped and lean he was. But if it's eating muscle at the same time, because that's going to lower your testosterone too.
Correct.
If you're burning muscle. So I don't know, you think he's probably on TRT or something to keep his testosterone high? Or, what would that do?
You're out of my realm there.
Sorry.
But there is some evidence that if you are maintaining the protein and you are exercising, then you are doing a better job maintaining that muscle mass.
Gotcha.
And I think I have been able to help people get off and wean off of it. But then the trend, unfortunately, is slow weight gain again.
Gotcha. Now, I know it's over 20 years you've been practicing now. How many is it total?
Over 27.
Okay.
I said 28 earlier, but I rounded up a hair. Only a hair.
We'll forgive you for that. It's no big deal. So over 27 plus years, guys started bringing up hormone therapy and that sort of thing. Have you seen a lot of things change in 27 plus years, like whether it's hormones or, anything to the market that's changed, pharmaceuticals? Like, what have been some of the big changes that have happened?
That's a great question. The longer you're around, you see fads change and you see things swing. And what's interesting is back in 2002, and I'll try to not get too far in the weeds on hormones for you, but in 2002, the Women's Health Initiative came out with a very big study on hormone replacement therapy, specifically Premarin and Provera. And what's interesting is the first thing they did is they held a press conference and said hormone replacement therapy is going to cause heart disease, breast cancer, and strokes and blood clots. Mm-hmm. Okay. We, as providers, did not have the study to refute this or to say, whoa. And so everybody freaks out, as we all did, because oh my goodness, what are we doing to people? And I was living in Portland at the time, and eventually the study came out, and I reviewed the study, and I was like, that's not what the study says. So I called this doctor. His name is Dr. Leon Spiroff. He was living in Portland, but he was world guru on anything female endocrine. And I called him. I said, I got tagged to do this talk on this. And what they're saying is not what's in it. And he goes, I know. And so he helped me with my lecture, and it was like a public forum. He helped me with my lecture, and I asked him, I said, okay, this misinformation, how long is it going to take before we reset and put this misinformation in context? So guess what he said? You guess.
I have to guess?
You have to guess.
I don't know, maybe first thing I think of is the sugar industry buying off the FDA back in the 60s. So I don't know, forever?
20 years.
20 years.
Okay. So for the last, up until about 5 years ago, has that misinformation put into its kind of perspective. But the interesting thing is we flipped full circle to now the messaging is everybody should be on hormones instead of a judicious approach. So we went from fear to, the opposite end, that everybody should be on it.
So, of course, my conspiracy skeptical mind first now goes to who did it behoove to put that out there that it was leading to?
Well, it was the scientists, right? And it was for their gain to come out with this landmark study that everybody listened to. Now I think I'm not going to get into anything, but I would also say that COVID and everything with COVID really gave a big hit on the science community.
Yeah.
And used to, if I said, I'm a doctor trained at Vanderbilt, did my residency at Emory, people would give me the opportunity to be like, oh, she may know something.
Right.
I might listen. I might know. I mean, I may not agree, but she'll have some information that might be helpful. And that has definitely changed. So what's so fascinating is I think we're in a phase now where people get more of their information from social media, and the experts are the people that are really good at self-marketing.
Right.
And, when I think about marketing, it's like I don't remember any physician group market, okay? When I came back to Chattanooga, there were a number of people who marketed on billboards and stuff like that. And that fascinated me. I was like, in a community this size, why would you need a billboard?
Right.
Because everybody I know that's good is busy.
Yeah.
Because of word of mouth. Fast forward to now, you have people who are on TikTok who have, billboards. We had my group, Galen Medical Group, did a big marketing push with billboards and stuff. And I would not let them put me on a billboard for the first year. And finally, one of my partners said, "Stop being a dork." And so then they put it, and I was like, and then that marketing went away, and I was like, thank you. But it's just fascinating. So is it that people listen to the loudest without looking at credentials or looking or thinking through this with critical thinking skills? If I'm making a ton of money on my supplements that I'm giving you, should you ask me more than just automatically listening to me?
Right.
I don't know. I mean, you don't want somebody to lose money. I don't want somebody to lose money.
Sure.
And if you're working hard, then you should be able to monetize it on some level. But where's the balance there?
Yeah. I've definitely seen almost specialists popping up from even within your realm of hormone replacement therapy and that sort of thing. And and maybe it's, I guess a doctor has to sign off on it on some level, but we see it a lot in maybe not the hormone replacement therapy, but Botox or injectables, fillers, a lot in med spas, and they have a doctor that signs off somewhere, and then maybe there's a PA on site, or a lot of times they'll just zoom them in. You'll see some sketchy stuff, and then especially filler can have some, and I know this is off topic, but filler can have some bad effects. If they put filler in the wrong place, especially on your eyes, stuff like that. If you don't have someone on site, really, it's kind of scary. But now
to your point in hormones, to that total point, what's so fascinating is in the last 2 years, I've seen an increase in complications related to inappropriately prescribed hormones in the last 2 years more than I did in the last 25. This space has gotten so popular, and what is the definition of an expert in hormone replacement therapy? What is that definition? Is that self? For me, I would say 27 years of experience, having the specific training that I did in residency and going on to do the additional functional medicine and integrative courses that I have done for for women's health. I would put that into the category of that. But what defines an expert? How much training do you have? Just because you know something doesn't always know how to apply it. And so with all these complications, what that implies is the lack of understanding of the risks.
Yeah.
And I want you to feel better, and I also don't want you to have the risks.
And it is something that kind of mimics what we deal with in marketing advertising, different type of risk because we're talking about the human body versus a business. But we see specialists a lot that only look at one part of a business. Maybe it's just the Google ads or just Facebook ads or just the website, as opposed to the holistic view of all of that is really your whole marketing advertising. I think we're seeing the same thing happening with these pop-up, hormone clinics and that sort of thing. You're looking at one piece of the puzzle and like you're saying, you're looking at 6 different pieces, and
right.
if a hormone clinic, if their business is to prescribe hormones and shoot someone off TRT or whatever it may be, Clomid or something, they're probably going to find a reason to do it. I mean, hopefully not. Hopefully they're good, honest people, but there's also a lot of other parts, right? Like what's their cortisol levels? What's their diet? One thing we were talking about earlier that I've been trying to do like food diaries and is, the estrogen that is, whether it's plastics in our food or whatever else, like how much we're consuming every day. It does seem around us, it seems like, at least in America, testosterone seems to be down. It seems to be that estrogen's up, and it seems like we have, was it 1 in 3 are diabetic or pre-diabetic in the United States now is a stat I heard. And it does seem like we're consuming a lot of that in food, and it's increasing estrogen and fat and decreasing testosterone.
Well, you're increasing estrogen, you're increasing the more toxic estrogen, you are less likely to process and get rid of it, and you are having substantially more inflammation. And that is probably one of the underlying causes for a lot of the chronic diseases that we have.
There's a stat you were mentioning earlier as I get a drink out of my plastic bottle here in a minute. But
I know, I'm drinking. You gave me a plastic bottle. That's going to add to the Ziploc bag that's already in my brain.
That's the stat I was talking about. So was it by a certain age, Ziploc bag worth of plastic?
And I qualified my comment that I did not verify the study, but it did say that you had, by the time you were in your 40s or 50s, you had the equivalent of a Ziploc bag in your brain. And I was like, oh.
I'm inclined to believe it. I mean, even the food you're talking about wrapped in plastic. I mean, how much do you go through, like in a personal life, trying to get like cleaner food and keep plastic out and that sort of thing? Is that something you're pretty cognitive about?
Yes.
Yeah.
Very much. And I want to look at this in balance, right? So I'm not going to go to 10 grocery stores to try to do that because that's going to cut in my hike time with my dog.
Yeah.
Or my cooking time or whatever. But I try very hard to just at the very minimum try to get all my vegetables and produce not wrapped in plastic. And then I try to get organic meats and then organic dairy. And, the consumption of dairy in my household, my kid's off at school, but we still have a decent consumption of dairy. And making that organic is important. So I'm not going to spend $2,000 to say I'm going to get everything organic and go to like 10 different grocery stores, but I am going to prioritize those 3 areas. The other thing that I've done too, I look at products, skin products. I don't use a lot of skin products, but looking just at skin products, shampoos, etc. And one of the great places to look is the Environmental Working Group, just looking at what we put on our bodies. In our hair, how that's being absorbed. And so we think a lot about food, but what else are we doing? And so there's definitely different skin products that I've changed purely for that reason.
That's something I have not really looked into. I have noticed like a lot of skin sensitivities as I've gotten older. So like certain moisturizers like I won't do well with. And I found some that, usually have less ingredients, but I'll be honest, a lot of the ingredients I still can't even pronounce, let alone know what the hell it is. I know aluminum's bad. That's one thing. Like as far as deodorant, putting aluminum deodorant. There's always those. What are your thoughts on fluoride? Is that something you've ever dove into, or?
I have not really. I haven't really dug into that. I'm going to use fluoride because I'd rather not have cavities.
Yeah.
But I also look at it in the whole picture of what are the things that I'm going to try to work on. right? What's more doable? What's going to give me a little more bang for my buck? I think it's going to be the food than the toothpaste, but
Yeah.
I can't answer on that.
Gotcha.
But I'll look into it.
If you dive down the rabbit hole, you'll find like, well, it calcifies your frontal lobe and all this stuff, and they use it in our water. And there's some weird things. I'm like, why is it in our water? And there's reasons for it, I guess.
Well, you know what I think is interesting is the moment you get super laser focused like that, go there, but then immediately take a bigger view.
Yeah.
Again, because the moment you focus on one thing, you've missed 100.
Yeah. And there's a lot of misinformation to filter through. I mean,
there's so much. So, it's fascinating. Going back to my lecture on menopause, my husband and my son, we put certain things through AI because there's a couple things that I just couldn't get it to sound the way I wanted it to sound. And so we put it through AI. And what was so fascinating was there was definitely some benefit. However, they changed my information just enough to make it inaccurate. But when I showed it to my son, he couldn't see that because he doesn't have the background that I do.
Do you think it was on purpose or just on accident?
It was AI. They're not, I don't think they're, I mean, maybe there's conspiracy theory. I don't know.
Oh, yeah.
But what was fascinating was he didn't know that small change made that piece of information incorrect.
Gotcha. Yeah.
Which is so fascinating to me is it's like, you remember that old game Telephone?
Yeah.
Are you old enough to remember that game?
Where you tell someone something?
You tell somebody something, and then at the end you're like, what is it? And it's never the same as what it began. How it began. I haven't used all the AI programs, but one that I use fairly often is the one through Doximity, which is a medical based app. And what they do is they put their resources at the end. So if you ask a medical question, they'll give you the answer, but then they'll give you their sources.
Interesting.
Which is interesting. So I've put something in ChatGPT and I've put something in Doximity, and they both have good information. I think that ChatGPT rewrites it a little bit more clearly than the other one. It's a little more clunky, but they're also more likely to create something incorrect by just making it little adjustments.
How often, are you seeing AI change what you do or your industry or any changes that's occurring?
I think that, yes. One of the things that I do is I use an AI dictation service where I record the visit and then it organizes the information and then I put it in the note. It doesn't decide what to do. It doesn't give me recommendations. It just organizes the information. I do know that they're looking into, recommendations and stuff. That's not what I've worked with. And it's probably reduced my typing by about 30%.
Wow.
Which is good.
Yeah.
But that means it's not good enough yet.
Yeah.
Because I always have to edit. And I'm still doing the clinical decision making. It's not telling me, try this.
Right.
I'm doing the clinical decision making.
Do you think there will be a point where it will say do this and it will be right?
I think what would be very helpful is if you have a list of symptoms and then it gives you a differential diagnosis. So I give my differential diagnosis, it gives its differential diagnosis, and then you look at how does that align? And what that will help you with is some of these zebras. Now, most things are common, so you don't always need to know those zebras. But every once in a while, it's nice to kind of like expand that and go, 9 times out of 10, I don't need that zebra. Yeah. But wow, this one person, I needed that zebra.
It's interesting. It's one of the guys I had on a podcast 2 podcasts ago. He's in cybersecurity. Well, you know John Anthony.
Oh, yeah, he's a great guy.
Yeah. And we were talking about we had coffee this week as well, talking about AI some more, and where basically it'll eat its own tail, at a certain point, because it's just kind of fed more information from humans. But it is kind of interesting to think about maybe other doctors around the world, as they contribute papers, if it could potentially crawl them faster, maybe peer-reviewed articles, whatever it might be, and then document the sources so you have validity to it. Like, it's kind of an interesting idea. Like, maybe it doesn't necessarily give you new ideas, but it gives maybe other experienced professionals, doctors in this case, their synopsis of it. I don't know. You think you'll ever eliminate the need for a doctor? Think that's ever possible?
I don't think so. One of the things I used AI a lot. And what I like to use it for is additional information, but also how to organize my thoughts and what's in my head in order to speak it more clearly to other people so it's usable information. So who cares that it's all in my head? It's more about, can I help you feel better? And I found that, at least for me, that's where some of that is helpful. What's interesting is information does not create good outcome. So if I don't know much and I'm a medical student and I look at AI and it tells me, feed it the symptoms and it tells me what to look for. If I don't have critical thinking skills and some level of experience and knowledge or guidance from somebody else, that has not improved patient care. So one of the challenges that I think is if people rely far too heavily on a computer giving them data, then they're not going to use their critical thinking skills, which is an incredibly important part of that. And people aren't being taught critical thinking skills the way we were. I mean, it's just, I don't think anybody would argue with that.
I mean, even to simple auto mechanics, from Google and YouTube existing for the last, 20 plus years, 25 years now. But now with just being able to ask ChatGPT or Gemini or whatever and get an instant answer is. And I heard someone else talking about this on AI recently as an AI doctor of computer science focused on AI. And he's like, well, it already happened. I mean, look at how many phone numbers do you memorize now? It's all in contact. Yeah. And I hadn't even thought about that, where how many times you do simple math in your head, you got your calculator right there. And it's like, I guess back in school, and they say, well, you won't always have a calculator with you. It's like,
oh, I know.
Wrong. Now we do. And it has kind of dumbed me down, like I don't do simple math in my head. Usually I just pull up my calculator. I don't memorize a phone number. So I'm curious to see.
But, that all contributes to critical thinking skills.
Absolutely, yeah.
Is how are you working your brain?
Yeah. I think AI is going to reduce it more and more. There's already studies showing that people are just – there is a weird – have you heard the kind of phenomenon, though, where people will get stuck kind of like a ChatGPT, or I guess not to silo them. It could be any of them, but basically you kind of build a persona. In some ways it's kind of telling you what you want to hear.
Yeah. Well, I find that so interesting because that happens when you do any search. So I had a patient recently who she and I disagreed about something. And I said, okay, you look this subject up on your phone and I will look it up on my phone. And let's see where Google takes us. And none of our sites overlapped at all on where Google took us. Google took me to all medical scientific sites and sites that cited medical research, et cetera. That was everything that came out. And everything that came up on her phone, I'm going to say, because I'm not giving you all the information so nobody can try to figure out, but it was all fringe sites.
Yeah.
It was nothing that was based on science at all. And I said, look what your phone's giving you versus what's my phone. I'm not saying one is right, but the sites that you're looking at, they're not scientifically oriented. They're just not. And she was fascinated by that. You can't do that all the time because people are not going to appreciate that.
Sure.
But I knew that she would find that interesting. And she was like, oh, my goodness.
Yeah.
So we had opposite information, mine all scientific medical, hers not a single one of them. They were all what most of us would consider fringe sites.
Yeah.
Isn't that interesting?
Oh, it is. And I'll get in another conspiracy rabbit hole there, but there's a lot that Google, not just in North Korea either, it happens here in the States that it will not return in search engines based on what you're searching. And COVID was one of them for sure. Like that one.
Oh, yeah.
It eliminated all kinds of from Dr. Robert Malone and mRNA and everything else. I mean, a lot of stuff was eliminated. Even studies that I found before, and I would use other search engines like Tor browser had a search engine, and there's another one I forgot that I was using back then. But
so do you know who Ben Carson is? Dr. Ben Carson?
Yeah.
Okay. He's amazing. He's one of the smartest people I've ever met in my entire life. And I asked him, I said, what is going on? Why can't we get this information? And he laughed at me and he said, Tricia, it's all about money and power. When something doesn't make sense, it's about money and power. And we talked through that, and that's what it was. It was money and power.
Yeah.
Where that kind of information was not readily available in context.
Yeah. Wild times. And
I know.
Still living in them, I guess. Maybe forever. I don't know.
I know. I felt silly when he said that to me, but I felt like, well, that's right. He's right.
Oh, he's absolutely right. I agree 100%. You can go check other browsers. There's other tests you can do on it, but they literally will not return some things that are out there that scientists are saying are true, and they just don't have a voice anymore. It's kind of weird,
But where you get better is actually having a conversation and speaking to everybody. And so sometimes you do need to hear the fringe stuff because that helps you reset. And so it's just being allowed to only have one narrative is never going to help people.
Yeah.
And you should be asking questions. I mean, if there's anything we should be doing always is asking questions.
Yeah. Yeah, I mean, if humans are trying to solve problems, identify what's going wrong, you have to have all options open. I mean, if you're just siloed into one, and this is the only way, well, that's never how, even when I was studying computer science, that was never how we analyze problems. It can't be like, this is the only option. It's like, well, how have our operating languages gotten any better? How have they become more efficient? It's because people are opening up all options and reviewing better ways of doing things and writing code and shortening it. And I'll not go down that rabbit hole any further.
We'll get out of that rabbit hole.
Well, it's been great chatting with you. That was a lot less nerve-wracking than I thought it would be. But
so what's one question you've wanted to ask that you hadn't asked that is okay?
That is okay. There's some that are not okay. Most of them are not okay. I think I asked most of them. I was curious about the hormone therapy, and because as we talked before, like something that I've kind of studied with being 40 now and like trying to still be like as much peak as I can be of fitness. And in the men's world, there's ads everywhere for it. It's one of those things where you can get at-home TRT now. So I was curious how that was affecting the women's side of things. I guess
the testosterone.
Yeah, testosterone therapy and
well. What I think is there's not enough studies and data on testosterone in women. It definitely is helpful, but I don't think we have the best understanding of risks and side effects. It's also habit forming. That's why it's a scheduled drug. Okay. And so, it's habit forming. And so that's a great way to build a clinic. If I can build a clinic on something that's habit forming.
I did not know that.
At high doses. So for women, there is some evidence that really at the higher doses that it's more habit forming. And it's a drug with street value. That's the other reason why it's scheduled. So, the different schedules of drugs are either related to street value or addictive nature or something like that. And so there is an element of habit-forming nature in it. And I think it's wise to just be careful with whatever you are going to put in your body. And I definitely have patients that do so much better, but it's not 100%. It is not 100% because, at least in my experience, which is a pretty big experience, a lot of women will feel better, but then they will also have side effects more quickly than with other treatments that you might give.
Gotcha.
So there's definitely a place. I definitely think we need more awareness. I definitely think we need more studies on this so we can look at this. We don't have any FDA-approved sources for testosterone for women. And so where it is in the compounding world, which isn't studied. And the reason why it's not studied is because there's no quality controls in that space. So when it's not FDA regulated, you do not have external quality controls that are regulated. It's not automated. You don't do batch testing, meaning you don't check to see if that's what you're giving.
Yeah.
When there's been external studies looking at this, looking at supplements, there's anywhere from 0 to over 100% more of something that's in it. So I think it's unfair to women that there's not an FDA-approved testosterone that can actually be studied for that benefit.
Yeah, I didn't realize all of that, to be honest. That is very interesting. So where are they sourcing this from? I mean, I guess China. I'm sure a lot of it comes from China.
Well, it's compounded. So what you could do is you could take the testosterone that is FDA approved for men and then compound it, change the dosing, et cetera, and have it for women.
I got you.
Okay. So it's not just that you're taking something from another country or anything like that. So like compounded Ozempic, semaglutide, there's probably some of that is taking the FDA-approved semaglutide and then making that into the compound. But you also don't know where you don't know where it's sourced, right?
Right.
And so it's really hard to study an unknown.
Yeah, that's very interesting. I didn't know that it wasn't FDA approved for women.
The doses for men are much higher than what would be appropriate for women. And and there's no FDA-approved treatment for women. So that we need to change. We need to be able to see more studies on that. And that's one of the great things about hormonal health, menopause, women's health being such a hot topic is hopefully there's going to be more helpful research because everybody throwing out their idea is not really going to be helpful for women. What's helpful is a thoughtful approach with what we know, understand what we know, and understand what we don't know.
Is there anything that I missed today that you want to talk about?
I would say that you didn't miss it, but it's such a passion for me to look at this whole approach and looking at diet, exercise, sleep, stress management, appropriate use of supplements and medications. And really, life is a journey. And what is going to work best for you right now to help you feel better might be different than in 3 months. So don't just focus on that one thing. Like, I told you about hormone replacement therapy. I was so miserable. I wasn't doing anything. I started hormone replacement therapy. Then I went back and looked at my diet and exercise and improved that so that I didn't just feel 70% better. I felt 90% better. And so you definitely touched on that, but that would be the only thing I would love to emphasize more is looking at the rest of that.
Gotcha. I do agree with that. I mean, even on of course, I'm not a female, but on the male side, or just human, I mean, animals in general, I think it applies really to everyone, like having that holistic view of what you're eating, everything you're consuming, stress levels, exercise. I've noticed that in my own life, and it's really hard to balance with work life. How do you balance it with work life? I mean, long hours in what you're doing, or?
Well, a couple things. First of all, I have a husband who is super, super supportive on me getting the rest, relaxation, exercise. So we've always had like a good partnership. The other good thing about it is our skill sets are complementary. Our skill sets don't really overlap. So we don't have to fight over the kitchen. I love the kitchen. I love to
Nice.
cook. And he fixes everything in the house.
Yeah.
So he's always been really, really great on kind of balancing that out. When Walker was little, just always. And so when there was free time, he allowed for me to what he did on the home front allowed for me to go take a hike with the dog. The other thing is you have to reset on not just what you want, but what you're able to do. So I heard this fabulous podcast. This was probably about 5-10 years ago. And the woman said, the 15-minute walk I did was much better than the hour I never got to at the gym. So I have done a personal self-study where how much time to exercise will move the needle on just me feeling better. And a 15-minute walk will make me feel better. So I do that. Is that going to be my exercise every day? No.
Yeah.
But am I breaking it down into time increments that are doable? So really being present and thoughtful and thinking about my day is like, I don't just start my day and go. I think the night before, what do I need to do? Can I exercise tomorrow morning? Nope, I'm starting surgery at 7 a.m. Tomorrow is not an exercise day. It'll maybe a short walk after dinner or something, but tomorrow's not my exercise day. The next day I start at the regular time. Okay, I can exercise then. So it's really, I would never get anything accomplished for myself in the realm of self-care if I wasn't thoughtful about what I was going to do the next day.
Gotcha. It sounds like your schedule can change on each week, like day to day too.
Oh, it can change in 2 minutes.
Yeah.
So I might have to deal with an emergency. The other day I got really backed up because of a really, really sad emergency with a patient. And I needed to stop and attend to her needs. And that derailed my whole morning, but that was appropriate.
Yeah. Yeah. That's got to make the whole work-life balance that much more challenging. Like you kind of just have to fit it in where you can. So I see.
Yeah, but you have to be thoughtful. You have to be thoughtful, and you have to make choices. You really do. Another mantra that I use is, if I say yes to that, what am I saying no to? And 99% of the time when I say yes to something, it means no to quality of life.
Yeah. Yeah.
Not always, but you know.
That's the one I struggle with, is the ability to say no. Maybe it's harder in the South too. I feel like it's easier up north. But being able to say no comfortably, whether it's to work or whatever it is, friends.
Oh, yeah.
That could be a tough one. Still learning that one.
Well, you're going to say no to a lot of good things.
Yeah.
And it's not good or bad. You're going to say no to good things. It's just too much. And, there's only 24 hours in a day. And so when people are struggling, one of the first things I think of is they have a 24-hour day. They're putting 26 hours of work in.
Yeah.
They will struggle.
Yeah.
And that's one of the first filters that I'm thinking of is, what are you trying to put in your 24-hour day? And you're never going to find 3 or 4 bad things to take out. It's going to be adjusting multiple areas. But what do you want? Do you want to just survive, or do you want to thrive?
Yeah.
And to that point, a lot of us spend a lot of time in fight, flight, or freeze. And that's not when we make good decisions.
That's a good point.
That's the sympathetic nervous system. The parasympathetic nervous system is where you actually absorb your food, digest, rest. That's where you have quality thinking. That's where you can make better decisions. We don't spend a lot of time in that space.
That really hit home right there. Yeah, I live a lot in the former for sure.
Most of us do.
Yeah.
And one thing, not to add to that, but I will, is being mindful of your circadian rhythm. There is a 24-hour clock in your body that is there.
Yeah.
And you can will it away, but it ain't going anywhere. And the more you attend to those rhythms of your circadian rhythm also makes a big difference for the fight, flight, freeze, sympathetic versus parasympathetic nervous system.
I had a coach that pointed that out to me a couple of years ago, and he said, if you go to bed, start testing it. But I found that if I went to bed after 10 p.m., especially after really 10:15 is about a cutoff, but I slept worse. The next day I was worse, and sleep was worse. But if I can get in bed between 9 to 10, be asleep in that time, I slept so much better. Woke up better mentally, less brain fog. So definitely something to that. And it's hard to do, especially in summer hours. The sun's up to 9:30 here.
I'm not saying it's easy.
And I want to be out playing when the sun's up.
But if you're not thinking about it, are you ever going to do it? And are you going to connect those dots? Unlikely.
Yeah.
Well, see, you learned something from me today. That was kind of cool.
Oh, I learned a lot from you today. Yeah, I was just sitting there thinking, this could be a multiple podcasts, just dive into the weeds and all this stuff. No, it was really, really great to talk to you, and definitely could be a lot more podcasts because there's a lot of things I'm so curious on. You just
thank you. Thank you.
Thanks for coming on, chatting with me. Hopefully you enjoyed it, and hopefully it wasn't too bad.
Did. No, I thoroughly enjoyed it.
Were you nervous the whole time, or did it?
I was only nervous at the beginning, but my passion for women's health and a holistic approach to life is so important that once you get me on there, I'm like, yay, this is fabulous.
Oh, great. Well, thanks again for coming in. If someone wanted to find you, Galen Medical Group, Dr. Patricia McClellan,
yes.
Website as well. I mean, it sounds like you're booked out probably from here on, but if someone wanted to look you up, is that the best place to find you?
Yes.
Okay. Perfect.
Or in the woods hiking with my dog.